My fat man drinks lemon rose milk is the mnemonic for the causes of nephrotic syndrome. Minimal change disease, which is most common in children, focal segmental glomerulosclerosis, membranous nephropathy, common in white adults, diabetic nephropathy, lupus nephritis such as systemic lupus erythematosus, renal amyloidosis, membranoproliferative nephropathy. For the features of nephrotic syndrome, remember nephrotic, sodium and water retention, edema, which is generalized pitting, proteinuria, more than 3.5 grams per day, hypoalbuminemia, with aluminum level less than 3 grams per deciliter. Renal biopsy is definitive diagnostic test. Oval fat bodies in urine. Thrombosis and infection are complications. Corticosteroids are the treatment of most causes. Vital star is the mnemonic for the treatment of nephrotic syndrome. Vaccine with 23 polyvalent pneumococcus vaccine. Steroids with salt restriction. Statins for the patients with chronic nephrotic syndrome. Angiotensin-converting enzyme inhibitors decrease proteinuria. Renin-angiotensin-aldosterone system blockage in hypertensive patients.